Hello and welcome back, everyone. This is part 2 of our video on the format of history writing. Before we get started, make sure to hit the like button, subscribe to the channel, and share this video with your friends. It really helps us grow and keep making helpful content like this. If you're new here, I recommend watching our previous video first for better understanding. Alright, let's dive in. Alright folks, let's come to the next component, which is History of Present Illness, HPI. The history of present illness is the main and most detailed part of the patient's history. It explains why the patient has come to the hospital in a chronological and thorough manner. You should give this section special attention as it contains the key clues for diagnosis and clinical reasoning. We begin this section by elaborating on the symptoms mentioned in the chief complaint. This includes the onset of symptoms, the sequence of events, the characteristics of the symptoms, aggravating and relieving factors. A good way to start this section is with a sentence like, the patient was relatively healthy until you put the duration ago at which time they began to experience then the primary symptom. Then begin to elaborate in detail. For example, if the symptom is pain, you should characterize the pain using the following descriptors. Site, where is the pain located? Onset, sudden or gradual? Character, is it sharp, dull, throbbing, etc.? Radiation, does it spread anywhere? Intensity, mild, moderate, or severe? Duration and frequency, constant or intermittent? Aggravating/relieving factors, what makes it worse or better? There are specific characterizations for other symptoms. We will cover them in the future videos. After elaborating the chief symptoms, we should also explore other associated symptoms that were not mentioned earlier but could be related to the current illness. These can provide important clues and help us build a more complete clinical picture. Finally, we include pertinent negative symptoms. These are symptoms that we would typically expect to be present with the chief complaint, but the patient denies having them. These are important because their absence can help us rule out certain diagnoses. Always keep the progression of illness chronological, logical, and focused. If there was a previous admission related to the current condition, include that here with a brief summary. This structured and detailed approach helps in forming a solid foundation for the clinical diagnosis. Let's see an example for how to write HPI. And in the future videos, we will see each cases with examples. Okay, here it is. The patient was relatively healthy until 2 days ago, at which time he began to experience left-sided chest pain. The pain was sharp, pleuritic in nature, had a sudden onset, and was worsened by deep inspiration and coughing. It was localized to the left lower chest, did not radiate, and was described as moderate in intensity. The pain was constant since its onset. The patient also reported associated symptoms of fever, productive cough with yellowish sputum, and shortness of breath. He denied any palpitations, orthopnea, or leg swelling. So when we break it down, the patient was relatively healthy until 2 days back, at which time he began to experience left-sided chest pain. Site, left-sided. Character, quality pleuritic, sharp in nature. Onset, sudden onset. Aggravating factors, worsened by deep inspiration and coughing. Radiation, did not radiate. Severity, intensity moderate in intensity. Duration and frequency, constant since its onset. And the phrase, the patient also reported associated symptoms of fever, productive cough with yellowish sputum, and shortness of breath, mentions associated symptoms patient has. And finally, he denied any palpitations, orthopnea, or leg swelling. This indicates the pertinent negative symptoms, those we expect based on our chief complaint but the patient does not have. Those are consistent with heart failure, but due to absence of those symptoms, we rule out heart failure. Okay, let's go to the next part. Past medical and surgical history. This section covers the patient's long-standing or previously diagnosed medical conditions as well as any surgical procedures they have undergone. We ask about chronic medical conditions such as hypertension, diabetes, asthma, epilepsy, or HIV. Be sure to ask if the patient is on regular follow-up and whether they are taking medications consistently. Past major illnesses such as tuberculosis, hepatitis, or other infections that required long-term treatment or hospitalization. Previous surgeries include the type of surgery, indication, date or age at the time of surgery, and outcome. For example, appendectomy for acute appendicitis at age 14 with full recovery. Also ask about blood transfusions, trauma, or accidents in the past. Any complications related to past medical or surgical interventions. If the patient doesn't recall specific dates, approximate timeframes are acceptable. This information helps us understand the patient's baseline health status and whether their current condition may be complicated by past illnesses or treatments. The next one is personal, social, and family history. This section provides context about the patient's background, lifestyle, and family, which are essential in forming a comprehensive understanding of the patient and identifying possible risk factors for illness. Okay, personal history. In this part, we focus on the patient's life as an individual, from birth to current personal habits. Important details to include birthplace and upbringing. Where was the patient born and how was their early childhood development? Educational background. What is the highest level of education the patient completed? Occupation. What kind of work does the patient do? And does it involve any exposures or physical stress? Lifestyle and habits such as smoking, whether the patient smokes cigarettes or uses tobacco products. Alcohol, the frequency and amount of alcohol consumption. Pot chewing or drug use, including traditional or recreational substances. Sleep patterns, exercise, and diet if relevant. These details help reveal factors that may contribute to disease or influence management decisions. Next is social history. This part is about the patient's role in society and their interactions with others. Ask about marital status and living conditions. Is the patient single, married, living with family, or alone? Social responsibilities or activities, participation in community events, religious involvement, etc. Social stressors, any recent emotional or life stress like loss of a loved one, unemployment, displacement, or financial difficulty. Support system, does the patient have emotional and practical support from family or friends? Understanding social context is essential, especially for long-term care, recovery, or mental health. Okay, finally, family history. In this part, we look at health conditions that run in the family, like chronic diseases like hypertension, diabetes, tuberculosis, cancer, asthma, mental illness. Hereditary conditions such as sickle cell disease, hemophilia, or congenital heart defects. Cause of death for parents, siblings, or other close relatives if known. Pattern recognition, are there multiple family members with similar health issues? Here we have to know about first-degree relatives, which are parents, siblings, and children. This helps us assess the patient's genetic and environmental risks. Last but not least, we are going to see review of systems. The review of systems is the final component of history taking. In this part, we systematically ask the patient about specific symptoms related to each body system, even if those symptoms are not related to the chief complaint. The purpose is to ensure that no important detail is missed. This is different from pertinent negatives, which are symptoms we expect to be related to the chief complaint, but the patient denies them. In contrast, the review of systems includes questions we may not expect based on the current illness, but still ask to cover all systems comprehensively. The review of system covers the following major systems: head and neck (HENT), lymphatic and glandular system, respiratory system, cardiovascular system, gastrointestinal system. Genitourinary system includes genital and urinary tract. Musculoskeletal system. Integumentary system, skin, hair, nails. Central nervous system. Psychiatric or mental health, mood, behavior, cognition, optional in some formats. For example, suppose the patient presents with chest pain. In the history of present illness, we elaborate on that pain and include pertinent negatives related to chest pain, like no palpitations, no orthopnea. But in the review of systems, we go beyond that. Under HENT, we might ask, do you have any scalp tenderness? Have you noticed any hair loss or change in hair texture? Any history of headaches, visual changes, or dizziness? Even though these aren't directly related to chest pain, we ask to avoid overlooking other potential conditions or clues. So, pertinent negatives is related to chief complaint but denied by the patient. Review of systems are comprehensive screening of each system regardless of complaint. This step is especially useful for identifying coexisting conditions, silent symptoms, or systemic diseases. So guys, that's it for today's video on the essential components of medical history writing. I hope this breakdown helps you feel more confident during clinical rounds, exams, or even while preparing patient notes. If you found this video helpful, make sure to hit that like button, subscribe to EASYMED for more clear and practical medical content, and drop a comment below if you have any questions or topics you'd like us to cover next. Don't forget to share this with your classmates because learning medicine is easier when we do it together. Thanks for watching, and I'll see you in the next video.